Everyone, I'm Mohanya Doc. In this video, I'm going to talk about pneumonia. What is pneumonia? Pneumonia is the infection and inflammation of the lung tissue. How does the infection and the inflammation of the lung tissue occur? If you like this video and benefit from it, hit the like button, comment below, share and subscribe. Pneumonia can range in seriousness from mild pneumonia to very severe pneumonia. People who get severe pneumonia include infants and children. Pneumonia is the leading cause of death in children and infants. We also have elderly, especially those who are above 65 years old. We also have patients who have other health conditions like kidney, diabetes, and we also have those patients who have weak immune system, especially in patients with HIV/AIDS or patients receiving cancer treatment. How does the germs that cause pneumonia enter into our body? One, these germs may enter into our body through inhalation. When someone who has pneumonia cough, this air that they cough out may contain bacteria. You may end up inhaling these bacteria. Number two, we have aspiration. Aspiration is when food or fluid or saliva or vomiters may enter into the wrong pipe. These may cause you to cough, and sometimes this reflex of cough is altered. And number three, we have blood spread. Blood spread of pneumonia mostly occurs in those patients who use or inject themselves abused substances like cocaine. How do our body defend ourselves from getting these bacteria, or defend when these bacteria enter into our body system? Mostly this happens all the time, so our body normally has a way that it defends itself from getting pneumonia when we inhale these bacteria or these other viruses or fungi. One, it's what we call a cough reflex. When a bacteria or a virus enter into our airway, our body is triggered to cough. This coughing may spit out the bacteria that you have already aspirated, or any foreign body that you have aspirated. Number two, we have what we call cilia. Cilia is a hair-like extensions that line your air alveoli, or what we also call air sac, and also the bronchus. These alveoli are like hair-like extensions. In this diagram, I'll show you what is cilia. This is an enlarged air cell or an alveolar. Inside the alveolar, we have this lining of epithelium. The epithelium contains these black hair-like extensions. These are usually beat up the sputum, the bacteria that enter into the lung. When they beat up the bacteria, these bacteria and mucus will ascend, and you will try to expectorate them or spit them out. Number three, we have antibodies. Your respiratory airway has the most inside part of it is called the mucosa. This mucosa usually has antibodies type A. These antibodies, their work is to bind foreign substances like bacteria and viruses that enter into your airway. When they bind, they also notify that your immune system that there are bacteria that have entered, and this your immune system will respond and fight these bacteria. Number four, we have what we call alveolar macrophages. Alveolar macrophages are a defense mechanism in which your immune system have those immune cells that usually eat all the bacteria and viruses that try to enter into your lungs. In some individuals, these four mechanisms may not all work, especially in, let's say that your cough reflex is not working. Your cough reflex may be defective in case you have a condition. In those patients who are critically ill or those patients who have stroke, sometimes their cough reflex do not work. Also, we have those patients that are taking drugs like opiates, and also those patients who are also taking cough suppressants medicines. These are medicines that usually inhibit the cough reflex. Also, we have those patients who smoke. Tobacco smoke usually damages these cilia or these hair-like extensions, making you predisposed to getting pneumonia. Also, in those patients who have a weak immune system, like those patients who have AIDS, the alveolar macrophages may have been killed by the virus. So when a bacteria comes into your lung, there are no defense mechanism. From there, what causes pneumonia? 80% of germs that cause pneumonia are bacteria. These bacteria include, we have streptococcal pneumonia. Streptococcus pneumonia is the most common cause of pneumonia. These bacteria account for around 65% of pneumonia cases. Number two, we have Haemophilus influenza, which is the second most common cause of pneumonia. Number three, we have other bacteria like Legionella. Legionella is a bacteria that is transmitted through contaminated water. And also we have other bacteria like Staphylococcus aureus. Staphylococcus aureus is one of the most nasty bacteria that can cause pneumonia. We also have other bacteria like Klebsiella. Klebsiella is a bacteria that usually cause pneumonia in chronic alcoholics, those people who drink alcohol in excess. We also have other bacteria like Mycoplasma. Mycoplasma is very unique germs that usually cause atypical pneumonia in college students. Other bacteria that may cause pneumonia, we have Moraxella catarrhalis. Then we have other causes of pneumonia. We have the viruses. Viruses are the most common cause of pneumonia in children. These viruses include respiratory syncytial virus. We also have parainfluenza virus and other viruses like influenza virus. Pneumonia can also be caused by fungal. We have a fungal we call PCP or Pneumocystis jirovecii. This fungal or fungus is the main cause of pneumonia in those patients who have HIV. When you inhale air that contains bacteria, this air will land into the alveolar. The bacteria will release toxins. These toxins will cause a damage to the lung tissue. When it causes damage, your body will respond by taking immune system cells to that place. These immune system cells will produce inflammatory chemicals. These inflammatory chemicals include prostaglandins, we have histamines, we also have leukotrienes. These chemicals, their function is one, to kill the bacteria. Two, they signal other white blood cells to come into that area. Number three, they usually cause inflammation. Inflammation is whereby the blood vessels in that area will enlarge to allow more blood to go to that area, allowing more white blood cells to reach into that area. These chemicals, they will also make your blood vessels become more permeable. This will help white blood cells to leak out from the blood vessel into the surrounding tissue which is being attacked. These inflammatory mediators or chemicals will also lead to what we say your signs and symptoms. Signs and symptoms of pneumonia, we have fever, We also have a sweating, we have shaking or chills, we also have a shortness of breath, we also have chest pain, we also have a cough. Cough may be productive, that is, you may cough and produce sputum. In pneumonia, you may produce different colors of sputum. When you have a last colored sputum, this means that your pneumonia has been caused by Streptococcus pneumonia. When your sputum is green in color, this means that your pneumonia has been caused by a bacteria we call Pseudomonas or Haemophilus influenza. When your sputum is red currant jelly-like, this means that your pneumonia has been caused by a bacteria we call Klebsiella. From that point, we also should understand that pneumonia can be categorized into 4 types of pneumonia. These 4 types, one, we have community acquired pneumonia. Community acquired pneumonia means that this is a pneumonia that is acquired within the community. Sometimes the signs and symptoms of pneumonia depend with the type of pneumonia we have, and also depend with the type of bacteria that causes the pneumonia. There are those bacteria that can cause other symptoms apart from what I've said, other symptoms like nausea, vomiting, headache, muscle pain, and also other symptoms like headache. We also have those bacteria that can make you have a very severe pneumonia, like Staphylococcus aureus. Severe pneumonia may also have other symptoms like tachypnea. Tachypnea is when you have increased breathing rate. That is, when you have a breathing rate which is more than 18 breaths per minute. And then you may also have tachycardia, is when you have increased heart rate more than 100 beats per minute. And also you might also experience what we call rapid breathing. Rapid breathing include nasopharyngeal or widening of the nose when you are trying to breathe in. And also you might also experience what we call chest indrawing. Indrawing is the movement or sinking of the chest and around the neck when you are trying to breathe in. Number 2 type of pneumonia is hospital-acquired pneumonia. Hospital-acquired pneumonia is a pneumonia that a patient acquires when they are admitted in a hospital more than 2 days to 5 days. This is a very serious pneumonia because you might acquire a pneumonia or bacteria that are nasty. These bacteria like Staphylococcus aureus, we have bacteria like Pseudomonas and bacteria like Klebsiella, and other bacteria that are resistant to drug. Resistance means that they don't respond to common antibiotics. Because these patients you are acquiring pneumonia from are already ill, that's why they are admitted in the hospital. Number 3, we have what we call ventilator-acquired pneumonia. Ventilator-acquired pneumonia is a pneumonia a patient acquires when they are intubated. Intubated means that you have been inserted pipe that are inserted into your airway to help you breathe. You can get a pneumonia from that. And last, we have nosocomial pneumonia. Nosocomial pneumonia is a pneumonia that you acquire from what we call aspiration. We have said aspiration is when food, fluids, drinks, saliva, vomiters enter into your airway. This mostly happens when patients have conditions like patients are in ICU, are critically ill, also those patients that have stroke, patients, individuals who are drinking excessive alcohol, when they are drunkard, vomit, and already this drunkard has lost consciousness, they may end up aspirating. So watch part 2, where I'll be discussing treatment of pneumonia, how pneumonia is diagnosed, and how to prevent yourself from getting pneumonia. I'm Wahinya Doc. Subscribe. Thank you.